Hey guys, welcome. My name's Sam Willis and I'm the Senior Lecturer for the Australian Paramedical College. Now in this lecture, we're going to talk about the key principles of basic life support. Now there's no doubt that you will have already become comfortable and familiar with basic life support due to the readings that you've done. Maybe you've done a course, maybe you've attended the workshops. But regardless, what we're going to do in this lecture is to go over the key principles of basic life support. So in other words, what is it about basic life support that is important to the patient outcomes? Now, the other good news is if you're just about to prepare to go to the workshops, the first workshop, then this is a really good lecture for you because these are the principles that are taught at the workshop. And those of you who have been to workshop 1 and you're preparing for workshop 2, now, in workshop 2, you will be doing advanced life support, but it doesn't matter, it's irrelevant because the principles of this lecture are exactly what we teach in workshop 2. So in other words, the principles of advanced life support are the same as basic life support. The difference being between the two is that you get to do more things during advanced life support. Okay, so in this lecture, we're going to talk about the key principles of cardiac arrest management. Now, we're talking about the key principles. There's no doubt you will already know about danger response, A, B, C, D, E, and chest compressions. But we're going to go through that again, and we're going to go through it in some detail from 2 viewpoints. From the viewpoint of the paramedic, and not just the first aider, and also from the viewpoint of the patient. In other words, what's important to the patient. We're also going to recognize the links of the chain of survival and how they relate to patient care. So the chain of survival really is where it's all at. So that's really the guideline for this entire lecture. And we're going to go through each different link in the chain and talk about it in some detail. Understand what effective CPR is. Now, time and time again, you'll hear effective, timely CPR. But what does that actually mean? So we're going to talk through that. And recognize how to safely defibrillate a patient. Now, the good news is defibrillation has become safer and safer over the years, but there's still research being conducted as to how to make defibrillation more effective and more safe. Okay, so let's start by introducing it then. Out-of-hospital cardiac arrest management remains a hot topic in paramedicine. Now, that's because it comes with high costs. In other words, if you get it wrong, or if you don't respond quickly enough, or the conditions aren't right, then it comes with the life cost. Now, as you will already know through the readings that you've done and the experiences that you've had, approximately 80 to 90% of paramedicine really isn't acute life-threatening emergencies, but rather, chronic conditions that are flared up and that have been exacerbated by some kind of condition. But cardiac arrest management really is the opposite. Cardiac arrest management really is an acute situation that requires fast reactions, fast thinking, good communication, good team working, effective high-quality CPR, early defibrillation. And this is the reason why, because the brain can only last without oxygen for 3 minutes. Depending on which book you read, some will say 3 minutes, some will say 3 to 5 minutes. Regardless of the text you read, after that time period, the brain becomes irreversibly brain damaged, and therefore death follows very shortly after. Now, the even bigger problem is, let's say that it's been a 10-minute period, nobody's been doing CPR, you guys arrive on scene, you do amazing high-quality CPR with advanced life support, and you do all the different things that you do, so you provide cannulation and you give the adrenaline, and you manage to get a cardiac output back, which has been shown to happen. Now, unfortunately, if the brainstem is dead, in other words, no oxygen for 3 to 5 minutes, it doesn't matter what you do, that person will be permanently switched off when they get to hospital. In other words, you will continue to do what you do through your advanced life support protocols. You take them to hospital, they'll go up to intensive care, they'll be put on a life support machine for a period of time, and then that's it. After a certain amount of time, the life support will be switched off in consultation with the family. So again, this idea of 3 to 5 minutes is so important and ties in so well with what we're talking about here, basic life support. Now, I always say that you should never be put off by the word basic, because high quality CPR and early defibrillation are actually far from basic. So this is one situation, so this is cardiac arrest management, where the life of the patient hangs in the balance of the paramedic's ability to provide rapid, high quality care. Now, there are a whole range of different things that can get in the way of rapid care, including crew working, how long it took the person to call 000, and a whole range of other factors. But once you arrive on scene, establishing that cardiac arrest is in progress is really, really important. And of course, providing that high quality care once you've established it, again, so important. Management of cardiac arrest patient does follow the DRABCD model. We're going to talk about how they are adapted in the cardiac arrest situation. So here we have it then, guys, the chain of survival. Highly likely you've seen this before, but let's go through this together because this is really something that guides your care. So early recognition and call for help. Now, I remember one Sunday morning when I was a paramedic in London and we got called for somebody who had collapsed in the street. Now, when we arrived on scene, there was an off-duty soldier doing high-quality CPR and nothing was getting in his way of doing those chest compressions. Now, I remember it very well because it was your typical British weather, it was overcast, cloudy, chucking it down with rain. And when we arrived on scene, there was this person doing really good CPR. So then when we arrived, we did everything we had to do, continued the CPR, continued the advanced life support, high quality CPR, early defibrillation, got them to hospital, and that patient ended up surviving. But we can honestly say that the only reason that patient ended up surviving was because of that off-duty person, that off-duty soldier doing the high quality CPR. So early recognition and early call for help, yes, they are part of it. And as you can see here, early CPR. So the next thing they did after calling for help was to get straight on that person's chest. Then when we arrived, so what CPR does is, CPR is a holding tool. It basically holds the person until they can, the defibrillator arrives. So in other words, it provides oxygenation up to the brain and the vital organs. Now, if the CPR is not high quality, it doesn't do that, and it's absolutely pointless. Early defibrillation. So once you've established cardiac arrest, you've got on the chest, the next thing you do is get the defibrillator out. Now, it doesn't matter whether you're the bystander or whether you're the paramedic or you're a doctor or a nurse. This is what we teach. This is what is taught throughout the world. And what we're talking about here are directly from those guidelines, including the Australian Resuscitation Council guidelines. Now, let's say we've had good quality CPR before the paramedics arrived. You guys have arrived, really good high quality CPR. You guys arrived with the defibrillators because let's face it, the only thing that's going to convert a shockable rhythm is a shock, an energy bolt, a defibrillator. Let's say we defibrillate and we get the patient back. In other words, we get post-resuscitation, we return of spontaneous circulation. Therefore, we then have to do post-resuscitative care. And that's what this last chain is about. Now, the notion of post-resuscitative care is really concerned with keeping the person laying on their back, not moving them, not sitting them up, providing airway, breathing, circulation support. Now, most ambulance service guidelines will actually give you a step-by-step guideline for their paramedics, whether you're working in private industry or if you're working in the state services. And it usually revolves around airway control, oxygenation. Some services will allow you to do a 12 lead and tell you to take them to a cath lab when they're ready. Others will allow you to give adrenaline to raise their blood pressure if their blood pressure is low. And other services will allow you to give things like atropine if the patient's bradycardic, and if they're bradycardic, adrenaline and other, other drugs that can help speed the. So it's really based around A, B, C. But regardless of the post-resuscitative care, the themes are those are the themes where you've got to follow what your service tells you to do. And you will always keep your patient laying flat unless absolutely necessary to move them out of those positions. So that's the chain of survival. Get on the phone and get the help. Now, at the workshop, you are the help. So you're trained not to be the first aiders, danger response, send for help. That's first aid. That's before you get to the workshop. When you get to the first workshop, you are the help. So you need to try and adapt that to danger response, airway, breathing, circulation. Well, it's actually airway, breathing, chest compressions, defibrillation. And then, of course, depending on where the situation goes, if you get return of spontaneous circulation, what we've just said, keep them flat and get them to hospital as quickly as possible and do some vital signs on the way. but continuous monitoring. And if they don't come around, just get a second crew, get to hospital as soon as possible. And that's basically it. Okay, so this is what I've just said. You will always need to check for danger and tell your tutor what you're checking for. Checking for danger to myself, to my patient, to my colleague. Is there anything in the environment that could cause us harm? Doesn't matter whether you're a student paramedic, a qualified paramedic, a doctor, or a nurse. This is the primary survey. Response. Hello, can you hear me? Open your eyes. Give them a shake. Try and generate a response through pressure of the trapezius muscle. Now, under basic life support guidelines, we don't do a massive amount of the airway apart from opening it to get the tongue off the back of the throat. The reason being is we used to check for vomit and all these types of things, and all you're doing is delaying CPR, and CPR is the priority. Breathe in, so check it. So look, listen, feel. Really look down the chest. Put your hand on the chest if you need to. Keep the airway open. Feel for the chest rise and fall, and actually look for up to 10 seconds. Now, in the Resuscitation Council guidelines, it says if you want to check for a pulse, you can, but you don't have to. Now, what the evidence has shown is that even experienced, qualified nurses, doctors, paramedics, they struggle to palpate a carotid pulse under situations like this. So you'll need to take the guidance of your education person, your trainer, when you get to the workshop. But the Australian Resus Council guidelines say if you want to, you can, but it's no longer than 10 seconds. Now, if you don't want to, you don't have to either, but you need to just justify to your trainer, checking for signs of life, checking for breathing. They're not moving, they're looking pale, they're looking clammy, their lips are blue, the typical signs and symptoms that you would find with somebody in cardiac arrest. Now their breathing's either absent or not normal. Therefore, under the guidelines, the Australian Resus Council guidelines, they are indicated for CPR. And as you can see here, the C is chest compressions. Now, this part is really where it's at. Now, what you do from here onwards is so important. Basically, whenever you come off the chest, you need to be able to justify and defend your actions. Because if somebody's asking you to come off the chest, or if there's only two of you, and there's things getting in the way of you doing CPR, you have to be able to defend coming off the chest, because it's the high quality CPR at the right rate, at the right depth, that will really push the circulation, push the blood up to the brain. And if you're distracted, or if your CPR is not high quality enough, then you are really going to be scrutinized for that. And this is something that is taught all around the world, in the universities, in your advanced life support. So when you're doing your CPR, let's get this mindset right now that it's the CPR that's crucial, okay? Everything else is just not proven to save your patient's life. But high quality CPR, which we'll talk about in a moment, really has been proven to bring your patient back. And in fact, the only two things that have been proven to save your patient's life are chest compressions and defibrillation. So this is what this looks like, the breathing. Is the patient breathing? If they are breathing, then check the circulation and continue to try and get a response. If there is a circulation and there's no response and there's no signs of trauma, this is where you'd put your patient in the recovery position. Is the patient breathing and is it normal? No. Then get straight onto the chest. So that's just an extra aid, an extra visual aid to help you guys to think about what I've just said. Once you've started CPR, the next thing you need to do is to put the defib pads on. Now, the bit about if needed, that really relates to the defibrillation. Now, in workshop 1, you are following an automated external defibrillator. So you put the pads on, one here, one here. So one on the patient's right side, one on the patient's left axilla. And that's something that you'll be shown time and time again. Once you've turned it on, and if it says stand clear, charging, shock advised, then while it's charging, you're able to get back on the chest, do high quality CPR for that 15 seconds, and then come off the chest when you need to deliver that shock. Now, don't worry about charging while it's telling you to stay off it, just doing CPR while it's charging. It's completely safe to do so. Many studies have proven this. Once you've delivered the shock, then you will go around and you start using the oropharyngeal tube, then do your bag valve mask, connect the BVM up to the oxygen, request a second crew, do everything that you can, swap over every 2 minutes. And then once you've established that you can't do anything more, make a decision as to, Are we going to go to hospital or wait for that second crew? Okay. Now let's talk about high quality CPR. First and foremost, minimum time off the chest. Again, I can't emphasize enough the fact that that high quality CPR is pushing blood up to the brain. And for you guys to come off the chest is actually probably clinical negligence by today's standards. Now, when we talk about high quality CPR, this is what we mean. Arms should be locked with your fingers either interlocked like this or twisted like this, or some other way that allows you to press hard on that chest. Get nice and close to your patient. The closer you are, the more you're going to be able to lean backwards and forwards. Now, the guidelines say push at a depth of about 3 to 5 centimeters. That's really hard to try and measure, but it's nice and deep, and also allow the recoil as well to come up. So you're pressing down, but you're also allowing it to recoil and come up as well. You're compressing at a rate of about 100 to 120 compressions per minute. Effective communication is something that underpins all of this. So you're telling your crew, cycle 1, cycle 2, cycle 3, cycle 4, cycle 5, 1, 2, 3, 4, 5, 6, and just communicating. Okay, let's swap over. The more communication, the better, the safer you are. And of course, you're doing it at a rate of 29, 30, 1, 2, 2 breaths in 1 second, 1, 2. The reason we say 30 to 2 for now is because more and more evidence is supporting the notion that we don't need to take our hands off the chest to do the 2. And far too often we're giving the ventilations too slowly. Therefore, the cerebral perfusion pressure, the pressure going up to the brain is lost too quickly. And in fact, the process of doing CPR allows oxygenation to occur to the brain anyway. So we need to start really thinking hard about taking our hands off the chest. So there's more and more studies going on about that. Now, hands in the center of the chest is a really, really important one because there are controversies over what means the center. Some say between the nipples, others say it doesn't work. So just you apply some clinical judgment and try and apply them in the center of the chest. CPR from the side, not the head. Time and time again, we see students coming into the college and they're doing CPR from the head. Now, I understand when there's only 1 or 2 of you, you've got to try and do 30 compressions and BVM as well. But the guidelines clearly say the most effective CPR occurs from the side. And especially given that we're moving away from doing 2 breaths, you don't need to actually be at the head anymore. Now, highly experienced paramedics can do that because they understand all of this stuff that we're talking about. And not only do they understand it, but they're able to put it into practice. So I would say, if you absolutely have to be at the head end, only do that if you're an experienced, credentialed paramedic, not somebody who's trying to prove themselves. And I say that because it's one of the non-technical capabilities or non-technical skills. Egotism and trying to prove yourself is something that will get in the way every time. So if you're a junior paramedic, always from the side, because the guidelines have shown and the evidence has shown that the most high quality CPR occurs from the side. And of course, if you're wanting to be that great paramedic, this is the stuff that will make you a good paramedic. And of course, swapping over every 2 minutes is something we've already mentioned, and it's highly important. More and more research is coming out in this area, and research has shown that after 2 minutes, not only does your rate suffer, but so does your depth. Now, let's talk briefly about defibrillation. Now, we know that defibrillation is the only thing that will reverse a fibrillating heart, nothing else, not high quality CPR. Certainly a high quality CPR puts that fibrillation into a holding pattern, but it's only a large voltage of energy that will actually revert it. Now, just remember that AEDs can be used by untrained personnel. The idea is that you have a highly stressful situation in the public place and the public are able to go and get it, open the AED, put the pads on, press the button, and it talks you through it. Now, that's not you. You are doing this course, and you're definitely not untrained personnel. However, that means that you must be able to apply all of this stuff, keep calm, and always be safe. In other words, when it's saying press the shock, you make sure you stand clear, communicate effectively, press the shock, and then straight back on the chest without any thought, straight back. And of course, remembering that when you're putting the pads on, you're putting it onto clean skin, making sure that you shave the chest if there's lots of hair. You're putting on the pads nice and effectively, remembering that only 30% of that shock gets to the sinoatrial node where it needs to go to, putting them in the right position, and giving that shock as quickly as possible. Don't forget you need to defibrillate every 2 minutes, which is approximately 5 cycles of 30 to 2. Once the AED has identified a shockable rhythm, straight back on the chest afterward, and that's what we've just said, so straight back on the chest with no delays. So what we've talked about here, guys, is the key principles of cardiac arrest management. Recognize the links of the chain of survival and understand what effective CPR is and how they relate back to the chain of survival and how to safely defibrillate a patient. Now, this short lecture really is just the tip of the iceberg when it comes to cardiac arrest management, because it's a hugely popular and common topic, but it's something you can read about in all the ALS guidelines and BLS guidelines, something you'll do in the workshops again. So I hope you've enjoyed this lecture. My name's Sam Willis, and I look forward to talking to you again shortly in other lectures. Thanks, guys. Take care.